Welcome back. Now I'm going to show you a return demonstration on a Foley catheter. So as always, I'm going to perform my OE wipes first. So I'm going to verify my order. Then I'm going to gather my equipment. And I'm going to wash my hands. Then I'm going to identify myself. My name is Christina Valetic. I'm your student nurse this afternoon. Then I'm going to identify the patient by two different identifiers. One is, what is your first and last name? Second one, what is your date of birth? Then I'm going to ask the patient for any allergies they have. Do you have any allergies to shellfish? Do you have any allergies to latex? Any allergies to medications? Anything. Then I'm going to move on to the privacy, which I'm going to close the curtain or shut the door. Then I'm going to move on to assess the pain of the patient on a scale from 0 to 10, 0 being the least and 10 being the most. What is your pain rate? Patient states 0. So then I'm going to have the patient get in position. So I'm going to have them lay down with nothing underneath. And then I'm going to explain the procedure that I'm going to be doing a Foley catheter on the patient that the doctor ordered. So first and foremost, I'm going to open my sterile field, which would be first away from me, side to side, and then right here towards me. Then I'm going to grab my sterile gloves. Since this is a sterile procedure, I'm going to put those on first, opening like this, like so. Grabbing my dominant hand first. Grabbing the inner part of the glove to put the gloves on. And then I'm going to grab the inside of the cuff to put my second glove on. Now I am sterile. Then I'm going to grab my sterile field and place that next to my patient. And then I'm going to grab my field, sterile field, to go around the ureter, uretus, like so. Then I'm going to get all my equipment out. I'm going to open my lubricating, put that in the tray here. And I'm going to grab my syringe, take the top off. And then I am going to grab my catheter. So, first, I am going to grab one of the iodine sticks with betadine. And I'm going to contaminate one of my hands and open the labia. And I'm going to clean one side, throw it away, grab a new one, clean the other side of the labia, throw it away, and then I'm going to go straight down the middle with the third one and throw it away. Then I'm going to attach my syringe to the catheter. And then I'm going to grab my catheter and I'm going to place it in lubrication. I'm going to spread open the labia, find the ureter uretus, and I'm going to enter with the catheter. When I see the flash of urine, I'm going to go about 2 inches and stop. So I'm going to stop right there. Then I'm going to inflate the balloon. And then I'm going to pull back on the catheter to make sure that's in place. Then I'm going to attach the catheter to the anterior thigh of the patient with a stat lock. I'm going to hang the ureter bag to the frame of the patient's bed. Then I am going to thank the patient for their time. I'm going to follow up with my safety with the patient. I'm going to lower the bed and lock it, 2 side rails up. I'm going to put the call lights and any belongings within their reach. I'm going to assess the patient's pain level again, 0 being the least, 10 being the most. Make sure the patient is not having any trouble breathing. And then I am going to tell the patient that I will see them again, and I'm going to chart and document what I did. As far as removing the catheter, I would come in and I would first drain the bag, place the bag between the patient's legs, undo the stat lock on their thigh. Then I would come over here and I would attach my syringe, and then I would pull back to drain the balloon. And let's just say I got 8 cc's. I'd take them out and drain. I'd stick it back in and see if there's any more, pull it back out, drain that. Then, and I would make sure I do this because otherwise I could damage the ureter. Then I would pull out the catheter, and then I would have that in my hand. So then I would take my glove off, like so. That way I would be disposing of it all at once together. So that would be my return demonstration for a Foley catheter. Thank you very much.